Thank you, Guy.
Alors, ce matin, c'était tout à fait
Well,
intéressant.
this morning was very interesting. We heard about the One Health concept. I discovered that One Health dated back to 2000. In 2011, we already had some texts published on this. But the question I have is that between 2000 and 2021, if I hear Philippe Vermersch, he talks about One Health, and doctors don't know anything about it. If I talk to the general public, they don't know anything about it. So the question I have for you is, what do we do now to really trigger this One Health concept, and we really build on this? We engage farmers, the civil society, the general public, to make sure that this really becomes a reality, especially as the President of the Republic has announced the creation of an agency for the environment and health. So there are a lot of things, and there's HERA as well. So the question I have for you, Sylvie Briand, is what should we do now? What is the issue which means that this is not translating into actions? When we prepared the roundtable, you said something that was worrying. You said there's one minor crisis per year and one major crisis every other year, right? Quite. And this is the problem, is that we have more and more epidemics which have the potential of becoming a pandemic because the world is more and more connected, and so viruses travel just like people. And we also have high human density in urban conurbation, so more cities and more potential for epidemics. As we saw this morning, 75% of those epidemics have zoonotics origin, and you have billions of animal viruses. So the potential of having viruses infecting humans is not quite unlimited, but it's extremely high indeed. And so what is important is really to take those epidemics from the outset and to make sure they don't degenerate into a pandemic. And this is what we are managing to do most of the time, because we implemented a system based on new technologies where we screen all the information out there on the internet, especially coming from the media, with keywords. And it means that we can detect some signals. So we have about 3,000 signals a month. And on those 3,000 signals, we select about 300 and we study those more specifically, and over those 300, we probably keep 30 where we really check with the countries or with the different players in the field. And this really helps us detect epidemics from their very start, and helps us to react quicker. But sometimes, and this is what happened with COVID-19, even if the epidemic was detected very early, the respiratory pathogens are extremely quick to be transmitted, especially when it happens in a big city like Wuhan. And so from the moment when we detected that something abnormal was happening, then the virus has already gone to another country, another province. And so we're trying to catch up. We play catch up until we can gain time on the virus and stop it going elsewhere. So those monitoring systems are extremely important. And it's important that it's done at the very interface with people and animals, because with these diseases, the disease often starts with animals. Unfortunately, lots of pathogens which lead to epidemic don't lead to a disease with animals. With the flu H7N9, for instance, it didn't trigger a flu for chicken, but for H1N5, we could see H5N1, we could see that the chicken were getting sick, and so that could indicate that humans would get sick as well. So how will the information go to Sylvie Briand at WHO, to Aurélien Rousseau, with his responsibility at national level and all the healthcare professionals that he manages in the field? How do you get the information from A to be in that sense? How, Aurélien, how do you work in the field to dispatch the information, to really make sure that things are working in the field? Well, thank you very much for your invitation. And it's true, it was a very interesting experience. It's been over for a few weeks now. But let me tell you a few words about it. There's something that Sylvie said. One term, she said interface, and healthcare authorities have to constantly ensure that the interfaces are working, and that on the other side, that coalitions are created. On the first aspect, I don't think that we will ever have a French-style garden with the administrative and political organization to correspond to the general will of One Health. And I'm sure Dominique and Benoît will agree, but the history of the creation of agencies also comes from some lacking that we've identified in the last 20 years. So the work in the field is that we don't leave citizens alone when faced with the complexity. It's not up to the citizen to create the link. So that means that with our watchdog mechanism, with the different terms that we use, we can pass on the information we have. And I think that the crisis also showed something that is even harder when you're an authority or an institution, is you also have to say what you don't know. And I think that with COVID,
le Covid, parce que je n'ai pas compris l'empressement à féminiser cette
in French, you can either use a feminine or a masculine noun for COVID. So anyway, I'm using the masculine, he says. So it's true that we have this position as a position of authority, but you still have to say when you don't know, and it's difficult for a ministry or a minister sometimes, but it's important to do so. And I think in this One Health mechanism, we have to be able to say that we don't know yet, that we can't say anything definite, but it's something that we have to be able to realize. And you don't have, on the one hand, the field, and on the other hand, the administrative world during the crisis. I think we were all in it together. I think we were all pushing in the same direction. And I think the condition for it to work, and I think that's where the crisis revealed this, is that you have to work as a coalition. In May 2020, when we put together the first detection centers at Clichy-sous-Bois, you had the health insurance authorities to open rights for people who didn't have rights before. You had the préfet, the mayor, who provided the tents, and you had the ARS, you had the departmental council to pick up people from where they live. So all this coalition is a prerequisite, and it means for healthcare authorities you have to accept the idea that you can't do anything on your own anymore. And between action, information, and so on, you have to onboard people, you have to onboard institutions, you have to be credible. And credibility also comes back to saying, I know this, I don't know this, I know someone else here. It's not true you can do something alone. Even in this very centralized French nation, you need to onboard lots and lots of players. That's a great message, and I hope that when we are in the new world, the post-crisis world, but when I hear Sylvie, I hear that the new world is not for tomorrow, because we are going to get straight into the next crisis. But we'll probably have learned that working together is good, breaking silos is good, and that gives me my transition to go to Benoît VALLET. You are chairman of ANSES, and you're also general manager of the regional health authorities of the northern region of France. I feel I haven't worked in the healthcare system in France for a long time. There are two structures that I don't know about. There are two new acronyms. The CASA, the first one, which is a committee for steering healthcare systems, agency systems rather. So you have to have a degree to understand what that means. And then you have an interministerial committee on healthcare. And I would like to ask you, basically, do these structures work? Have they worked amongst themselves as well? Santé Publique France has been completely silent during the entire crisis. So what is going to make a coherent system in the future, which will enable you in the field to have different players work together and pass information in a very specific context? If you fight against anti-vax, you realize you have this disinformation campaign on the social networks. Thank you very much. Thank you for this introduction. It's great to be surrounded by people I know well, and it's always nice to talk on topics that are dear to us. I think that COVID has taken us pretty fast to the question of One Health, and the acronyms that you talked about were very active in this COVID crisis, except possibly the Health Interministerial Committee. So you have ANSES, CASA, CIS today, which held the One Health policy at world level, at national level, sorry, and these help the different players work together, because there are lots of different players working together under One Health, because One Health is about cross-discipline action and inter-ministry work as well. First, ANSES, the National Agency for Health, be it food, work, health, and you can't find the keywords within the definition of the acronym, but that's by the by. So this agency, which is really a One Health agency, which was created by the merger of different players that existed before, brings together the Health Ministry, the Agriculture Ministry, the Environmental Ministry, and Labour Ministry, and that of Consumption and Fraud, Anti-Fraud as well, to fight products that are brought illegally on the French territory and could be detrimental to human health. And this is including animal and vegetal health for the reasons that Sylvie mentioned earlier. So a number of pathogens can go from vegetal to animal and from animal to human health. And humans are really animals at the end of the day. Anyway, so this One Health agency brings together these different structures, which means that as such it's cross-ministerial, and it brings ministers together. It works with Europe, it works with research as well, and in Europe we work with agencies linked to food, animal, vegetal, healthcare, chemical products, and other major players such as the CDC, which is the European equivalent of Santé Publique France. Second acronym, the CASA, which is the Agency System Animation body. There are lots of different agencies, such as Santé Publique France, for instance, which looks into the way that human health is affected through epidemiology and pathology screening. And obviously worked a lot during the COVID crisis, and ANSES worked on animal health and animal diseases transmitted to humans, but also on virus search or virus screening in stagnant water or in sewers and so on. So the ANSES worked a lot in this particular field. So the CAASSEN was introduced in the law, even though it pre-existed the law. It was introduced in the law in 2016, and it basically works at getting those agencies to working together. ANSES, Santé Publique France, but also the Agency for Drugs, the French Agency for Drugs, which can have links to human health, of course, and so it's logical to get them to work together. So the question of babies born without arms brought together these three agencies, ANSES on environmental products, which could have an impact on malformation at birth, the medical agency with a number of drugs that could lead to malformation at birth. And so the work was done jointly to check if we could find a cause which could explain the birth of those babies born without arms. And as it has been done for years, malformations can't be always explained, and if they are limited in numbers, then there's no specific worry to have. Anyway, CAASSEN meets once a month, and the agencies work together for these different questions. But CAAASSEN also has some, also deals with health safety at the Ministry of Health, and it includes all the agencies, but also the heads of central administration. So the Wednesday morning meeting is a health safety meeting, and this is the requirement of the WHO to check signals at national level and to see how we deal with these signals at international level. And this General Health Department brings together the ministers and links that to politicians. And sometimes, obviously, the decisions are made by politicians at the highest level. And basically, they all agree on the actions to be made. I don't know if you remember what happened with Lactalis. That was a big case at the end of 2017. It was for powder milk for babies. And that was something to do with farming, with healthcare, but also with consumption and anti-fraud bodies, the health ministry, but also the finance ministry that basically called to stop the production of powder milk at the factory because salmonella had to be stopped in that particular factory, knowing that Santé Publique France had studied the connection and the weak signal in the different places in France for that question of salmonella. So, ministerial question. And then the third acronym is the Health Interministerial Committee, created in 2014 when I was at the Health Ministry, and it became a law in 2016 to take part in the writing of a health law. So it's about prevention, it's cross-sectorial, and many players come in play to work on this one health question. So this Interministerial Committee on Health exists and worked a lot. There was a first roadmap on antibioresistance in France in November 2016. Then it met again to define the new strategy for healthcare under Mrs. Buzyn in 2017. In compliance with the previous law, and then in March 2019 to pronounce the prevention roadmap at national level. And every time it's the Prime Minister of France who steers the roadmap with all ministers who can act under this One Health method. And then 2020 with food and farming, with healthcare and the health and farming ministry and agricultural ministry. And so we do produce things under this One Health auspices, and we obviously deal with the flora because we have products there, and we also have animal aspects. For COVID, it wasn't used, maybe it could have been, but this is one question that is asked by me anyway. So these are three essential acronyms that show that today One Health is a concept that has a reality and is operational in our country. Thank you very much for all this. I'm going to turn to Evo CLAASSEN. Hello. Thank you very much for joining us. You're a little bit far, but it's always a great pleasure.
Le rôle de l'EMA
dans cette construction de One Health, c'est surtout, in the construction of One Health is not so much on your missions, because we probably know your missions here in the room, but it's probably more in the way that EMA is going to start working with other agencies to make sure that One Health can work.
Thank you very much for inviting us and giving us the floor. And I have to apologize on behalf of Emer Cook, who is going to be here, but she is currently, I think, at the starting meeting of HERA, Health Emergency Response Authority, which is, you know, part of the One Health, I think, initiatives in the Union as well. The mission of the European Medicines Agency is to provide good scientific basis for human and veterinary health. So in that sense, already the One Health is embedded in there. And I think when you look at what we have been doing over the past years and what we are currently doing, there's two main topics that really are important there. One is antimicrobial resistance, which clearly I think is recognized as a One Health issue, with both carryover of antimicrobial resistance between human and veterinary populations, impacts on the environment that may occur, but also very much a European and a global perspective to it. And the other one, obviously, as has been discussed around the table already, is the response to emerging diseases, COVID being notably on the agenda over the past year and a half, and it has overshadowed AMR quite a bit, I would say. However, when you look at what binds both COVID and AMR is that on the side of AMR, in order to reduce the risks of antimicrobial resistance, we're also encouraging the search for alternatives. And there are very innovative approaches that the agency supports for developers, manufacturers, so that they can bring new products to the market that could indeed reduce the risks of antimicrobial resistance. The new veterinary regulation has a lot of elements which are relevant to antimicrobial resistance, veterinary medicines regulation, so that's a topic that we're working on. And recently, the Commission has asked agencies to start more interagency collaboration to indeed develop more effective programs to reduce the risk of antimicrobial resistance. On COVID, and listening to the discussion, I understand that in France, you know, different agencies, different institutions had to work together. For the agency, it has been the challenge to, in a crisis situation, establish also that collaboration within the Union, with member states, with the Commission, with ECDC and the other agencies, to indeed speed up the response and support the development and access to the markets of new vaccines based on new technologies, novel technologies. So that has really been exciting to follow and to see that it was indeed possible that within a year, and within a year that we could see the actual access to the market of these new vaccines and new technology. So and also the work on antivirals, and we expect that will continue for some time indeed. As a result of this new way of working together in the Union, we've also seen the establishment now of HERA, the Health Emergency Response Authority, and there is a relation between EMA, ECDC, and HERA. They need to start working together to ensure that emergency preparedness. On top of that, the agency has been receiving an extended mandate, so additional tasks. And those additional tasks do relate to emergency responsiveness, but also to looking at shortages during a crisis situation. I think all this is very much relevant. And it's clear that the only way we can do that is in clear collaboration with the other agencies and the member states. And I think the discussion that I stepped in, and again, apologies for being late on this, shows the complexity of that, because where already you can have discussions about how it is organized in France and how these agencies work together, we experience that same difficulty with all the other member states. And it's for us very difficult to come up with a European approach, which is at the same time science-based on advices that go beyond what is our mandate. Our mandate is to ensure safety and efficacy of the products that go to the market. But there's a lot of other questions about the use of vaccines in the European environment. Will or will we not go for a boost vaccination? How about specific exemptions for immunocompromised people? Will they need an additional boost vaccination? And to that extent, we do work with the other agencies, but also with the experts from the member state to come up to a good conclusion. And there, Mr. Chair, I would like to leave it for the moment.
Merci beaucoup, c'était tout à fait passionnant. C'est vrai que la complexité du système français, on l'imagine multiplié par 27, ça va faire beaucoup.
Well, we imagine the complexity, everything multiplied by 27 means a lot of complexity. And already institutions have trouble understanding each other. Can you imagine for chambers of agriculture, for healthcare professionals, for all the players? And Aurélien was discussing it earlier. When we are responsible and we need to understand about the strategy for face masks, vaccines, etc. If the information doesn't trickle down all the way down to us, it's very difficult to manage for a population, and it could lead to a negative impact. Dominique GULUDEC, how does HAS, the French Health Authority, react? What can you do to make the contribution as efficient as possible so that we finally meet objectives and achieve results that can be shown to everybody and especially to 66 million French people on the field? Well, we already do a lot in France, although we maybe don't make it known, but the French agencies are following closely everything that happens on the international level. The working plan for European healthcare in 2021-27, the creation of ERA or the new European drug agency, everything leads to a change in paradigm. And the WHO involvement in this new expert panel, I mean, we are not removing ourselves from these subjects. There are so many subjects. You know what we're supposed to do when we're supposed to assess new healthcare technologies, antibiotics, vaccines, tests, vaccination, healthcare organization, and the way we organize the patients, and One Health will be there, will be involved. I'll give you 3 examples. The example of the pandemic. These institutions have been working closely. The High Health Authority has worked very, very fast during the pandemic in order to advise the government, advise the patients, advise healthcare professionals based on transparency, on the knowledge as it evolved, clinical research, but real-life clinical data, and we developed jointly a vast knowledge which continues to change and evolves all the time. And we gave access very quickly to tests, vaccines, new drugs. And HAS has released 150 documents between March 2020 and now on COVID, including 45 recommendations to help healthcare professionals, within 8 days of having been asked to do so, we were able to produce a document. So agencies such as ours really rose to the challenge. And the resistance to antibiotics is very important. We are fighting against antimicrobial resistance. We are working on infections and on how to best use antibiotics. So I'll give you 2 examples. We have just released a new institution certification process with criteria that meet the needs to manage infectious risks or the relevance of prescribing antibiotics. AHS is also looking at the quality of healthcare, and we have something regarding the monitoring of healthcare-related infections, nosocomial infections. Last month, the French Society of Infectiology and other scientific societies have released recommendations on best practices in the use of antibiotics for all common infections and how to shorten to the minimum the duration of the use of antimicrobials and antibiotics. So we have new doctrine elements regarding antibiotics in order to meet problems such as shortages, population size, poverty, new antibiotics, and just to mention a few figures, between 2018 and 2021, we have seen 12 new antibiotics released on the market, 50 of which received level 3 ASMR. I mean, the pharma companies in this room will know what I'm referring to. 1/4 of SMR3s last year were antibiotics. The same goes for public health interest certification, ISP, which is approximately 25% of the certifications released. Now, environmental issues. We have participated together with ANSES and under the Ministry's auspices to the Healthcare Environment 2024 plan. For instance, when we're talking about preventing and acting on those areas where the ground is polluted, we're obviously the last ring in the chain, and we are there facing the healthcare professionals and trying to help them prevent damage and taking care of exposed populations. We are working with first-line professionals on what to do in the event of a pollution peak. So, I mean, it's One Health. It is One Health. It cannot be anything else. There's a lot of work, but we have our work cut out for us, but we can do even better. We do a lot, but not necessarily in full awareness. I think we need to continue educating people in our agencies, and we need to encourage multidisciplinarity. We need people from the animal health sector, and even us working for human health, we need support from the others. And this work needs to be coordinated, not only on the national level, but also on the international level. Suffice to say that we need to exchange our knowledge, our skills, our expertise. Let me conclude by saying that this crisis was very difficult for us, but maybe we will be able to bounce back. I definitely believe there will be lessons to be drawn. If we continue business as usual, things will become very difficult. I mean, the first concern for the yellow vest protests were healthcare issues. Now, back to a very simple example. I know for a fact that the President of the Republic, who will be with us tomorrow, is interested by One Health. Olivier Véran, Ministry of Health, said it's going to be a priority. France will be President of the European Union, chairing the European Union as of January, and he wants France to be a leader in this field. And, you know, when he wants something, he gets it done. I mean, we've seen it with the vaccination and the sanitary passport. So he expects the same to happen when France becomes president of the EU. So what do we do to make sure that it works?
Il y a quelque chose,
How do we organize ourselves?
venir évidemment à la réponse à la question autant que je puisse le faire. C'est que la crise, le président de la République et le ministre évidemment l'ont très vite mesuré. Elle a mis une espèce de coup de projecteur un peu cru, comme ici, une lumière un peu crue sur des choses qu'on avait écrites ou qu'on avait lues 150 fois.
Be it a bit brutally, on things that had been said already 150 times before. I mean, there is a common denominator in everything we say, the social issues, inequalities.
Julien de Normandie le disait tout à l'heure très bien,
il y a
les conditions pour arriver à faire du One Health. C'est les conditions matérielles pour se nourrir correctement. Ce sont aussi les conditions pour entrer dans ces fameux parcours dont on parle depuis 20 ans. Je crois, le 18 mars 2020, on reçoit et on est stupéfait les éléments de surmortalité liés au Covid. Et le département
overmortality figures due to COVID, and we were
ça peut paraître complètement stupide
thunderstruck. I mean, the area where there was the highest mortality was the Seine-Saint-Denis, north of Paris, where they have the youngest population, and at the time they said that COVID did not kill young people so often. So it actually led to two different questions, and the most worrying one was, did we not manage people well in the hospitals in this particular area, north of Paris, where the population is supposed to be young? So we started a study to understand, and what the study yielded was that actually people died before they reached the hospital. People died, relatively younger people died because they had no access to
que personne ne vous a dit que l'assurance maladie avait mis en place une prise en charge, y compris pour les indépendants. Vous me dites j'attends et à J+7, dégradation, parce que par ailleurs, beaucoup de déplacements, on fait ces métiers-là, donc des facteurs de risque sur l'obésité par exemple, et c'est des décompensations rapides dans les services d'urgence. Ça, c'est la question sociale. Et je pense que le président de la République, et il l'a dit à plusieurs reprises, la santé, on ne peut plus la décorréler de cela. Et le One Health dont on parle là, qui est celui de l'organisation, du dialogue entre les agences, du dialogue institutionnel, il passe aussi par le fait de se redire en fait comment on fait pour en parler aux plus éloignés du système de soins. Et c'est la bagarre qui est menée depuis des mois sur la vaccination, où c'est pas la peine de s'emmerder, pour prendre le terme scientifique, avec quelques pourcents d'antivax fanatiques. La question, elle est celle des plus éloignés, des plus pauvres, qui, eux, ne sont pas vaccinés. Donc moi, je voulais redire ça, parce que cet élément-là, il est décisif. Et je pense qu'on sortira de la crise aussi en se disant que One Health, c'est certes tout ce qu'on a dit, c'est aussi des trucs aussi basiques que le fait que la prévention et la promotion de la santé, avec par ailleurs des acteurs en France qui sont dotés d'outils extrêmement puissants, donc on passe par exemple aux data de l'assurance maladie ou ce que peut avoir le ministère, on peut aller vers les gens. Et je trouve que, moi je l'ai vécu comme tel, je suis arrivé à l'Agence régionale de santé, le projet régional de santé en Île-de-France venait d'être approuvé. Donc j'ai lu des choses sur l'allée vert, sur les inégalités, sur tout ça, mais j'ai quand même pris la même claque dans la figure quand en 2020, en 2021, à chaque fois, ce qui a été le principal déterminant, c'est cette question des inégalités. Et donc je pense que redire que ça n'est pas juste une question d'organisation, de dialogue, de clarté, mais aussi une question éminemment sociale, que du coup il y a la responsabilité populationnelle qui pèse sur tous. Ça veut dire le médecin de ville, ça veut dire aussi l'élu qui doit se dire que quand il fait de l'urbanisme, il fait de la santé. C'est ça aussi One Health. Quand il fait des pistes cyclables qui favorisent les circulations douces, il fait aussi de la santé. Et je pense que si on sort de là, en se disant et en ayant convaincu, en assumant une fonction de plaidoyer, que c'est un des axes majeurs et que chacun a une partie de la réponse, on sera plus fort. Or, aujourd'hui, la réalité n'est pas celle-là. Le débat politique, il est encore centré, et c'est juste, il n'y a absolument aucun sujet là-dessus, mais il est encore centré sur le nombre de lits de réanimation. Vrai sujet, je ne balaye pas. En fait, quand même, avec beaucoup moins d'argent et avec des politiques beaucoup plus proches du terrain sur la prévention et la promotion de la santé, on fait des choses pour le bien-être et donc la santé globale extrêmement puissante. Et je pense que c'est ce que le président de la République a voulu faire quand il a fait un déplacement à la CEPAM du Val-de-Marne, quand il avait demandé à l'assurance maladie d'appeler toutes les personnes de plus de 70 ans, toutes les personnes de plus de 70 ans de ce pays, d'abord, puis après d'autres ont été appelés pour leur proposer la vaccination. Ça, c'est du concret parce qu'en fait, il faut le prendre par les deux bouts, à la fois la technostructure, la gouvernance, et de l'autre côté, ce qu'on appelle le dernier kilomètre, mais qui est en fait le premier, qui sont les premiers 100 mètres vers le système de santé.
Tout ça, ça va demander des moyens d'information, de formation. D'une certaine manière, j'ai envie de vous poser une question provocante. C'est à l'EHESP de se charger de former les... Aussi. Les élus locaux, les publics intermédiaires, les journalistes au passage, parce qu'en dehors de ceux qui sont émérites et qui sont présents avec nous, il y en a beaucoup sur le plan de la santé qui ne connaissent pas grand-chose et surtout qui font du sensationnalisme. Alors, où est-ce qu'il faut les mettre ces écoles ou ces structures où on va se former et s'informer, non pas par silo, mais ensemble pour prendre en compte justement la responsabilité populationnelle, le fait de pouvoir dire à un pharmacien qui a un maillage remarquable sur le territoire, tu vas nous servir, toi, de référent dans tel point pour la vaccination, aux médecins qui t'entourent, aux infirmières, en coordination avec les élus locaux, pour dire, voilà, maintenant One Health, c'est ça, et il faut qu'on aille vers... et dans une commune comme la mienne, pour aller parler aux agriculteurs, en leur disant, mais vous êtes un échelon essentiel.
Maybe I will be in charge of talking to the farmers and tell them that they play an essential role. Well, there are many different players involved here, and of course HESP needs to train hospital managers or healthcare professionals by making them aware of the One Health idea, the fact that it's across the board and it involves everybody working in the field of human health, vegetal health and animal health, but everybody is included in the response, and HESP definitely has to play a role.
Aujourd'hui, vous le savez, en France, nous avons des facs de médecine, des facs de pharmacie, des facs concernant l'enseignement, par exemple pour les dentistes, mais aussi de l'enseignement qui est fait pour les sages-femmes, pour les kinésithérapeutes, etc., qui sont réunis en un seul ensemble qui s'appelle la faculté santé. Ça, c'est un mérite énorme, puisque déjà, ça permet aux professionnels d'être ensemble au service d'une seule santé. Encore faut-il les former pour une seule santé. Et donc là, il y a de la formation maintenant certainement incrémentée pour savoir ce que veut dire une seule santé, et en particulier en reprenant sans doute un certain nombre d'éléments qu'on a déjà développés à l'instant. Mais évidemment, comme le sujet est interministériel, intersectoriel, il faut qu'il y ait aussi des questions de santé qui soient enseignées dans des secteurs qui n'ont pas forcément beaucoup à voir avec les facs santé en tant que tels. Donc le progrès qui a été fait dans le domaine de la transversalité santé, il faut aussi apporter des capacités de formation dans d'autres secteurs. C'est sans doute une des missions qu'on a aussi à penser pour la formation de ceux qui viendront des futurs leaders dans ce pays et qui auront une responsabilité santé. Aurélien l'a dit, si on
responsibility in health in the future, as Aurélien said, if we reduce the health of the cars in the cities and we go to 30 kilometers an hour, then bicycles appear because it's much easier to cycle in a city like that. But it's important for the people who do this to realize that by doing this they're having an impact on health. So I believe that this training has to be introduced in the public policies, because otherwise it will be very difficult to have a useful impact on health if the people around the table haven't learned about what health is about. And to add to this, about the training, we have to include environment, because the reality
questions d'environnement qui touchent à la santé. On se préoccupe de l'environnement parce que la planète est affectée et que par effet d'incidence, la santé l'est aussi, la santé humaine ou animale ou autre. Et donc, les questions d'environnement doivent répondre à peu près à cette logique-là aussi. Sinon, elles ne seront pas appropriées par les acteurs qui sont censés transformer les politiques publiques en faveur de quelque chose de plus durable et de plus favorable à la santé. Donc, cette question de la formation à ces questions, aussi bien d'inclusion sociale, mais aussi de toutes les dimensions qu'on a évoquées autour de la table, est vraiment une question fondamentale pour aller vers demain. Ce que nous formons aujourd'hui sont les acteurs de demain. La recherche d'aujourd'hui, c'est la vie que nous aurons demain. Donc ces questions de recherche, ces questions notamment sur les données sociales et de formation sont extrêmement importantes pour que nous puissions aller vers un concept One Health. Vous le savez, aujourd'hui, de plus en plus, on ne parle plus tellement de One Health, même si c'est l'actualité qui nous
Now we no longer even talk about One Health, even though this is our topic today, and we see it's difficult. We no longer talk about global health either, but about planetary health, which is the all-inclusive health, which is the Anthropocene, the era in which the human beings change the planet, and this tackles the consequences of that.
L'apparition d'une carte et d'une étude de l'IRSEM qui montre qu'un certain nombre de pays ont gagné en 20 ans une influence absolument colossale sur les autres. Ils ont étendu leur zone d'influence sur la Chine, par exemple, sur 80 pays. Ils sont capables de mettre d'ailleurs 20 millions de personnes juste autour d'ordinateurs pour vous balancer de l'information.
China can put 20 million people around a computer to send information that is driven by a propaganda system. Don't you think that an organization such as WHO is a bit has a bit of a problem there because balances are changing in the world, and nowadays the war of information and disinformation is something that is true and basic. And when you're an institution such as yours, and we could say the same for CLAASSEN, how can you make sure you protect yourself against this? Well, in WHO, we've seen that for a long time. We saw that epidemics give rise to rumors. When you have an epidemic, you have a
cette épidémie-là, cette pandémie-là, c'est qu'il y a les réseaux sociaux. Et donc, ça amplifie les rumeurs. Et donc, dès le départ, le directeur général, justement, a sonné l'alarme en disant on n'a pas seulement en train de faire face à une pandémie, on fait aussi face à une infodémie, c'est-à-dire à une explosion incroyable d'informations partout, qui fait que les gens, en fait, sont bombardés d'informations, ne savent plus qui croire. Et donc, ça génère une confusion. Les gens ne savent plus qu'est-ce qui est vrai, qu'est-ce qui est faux. Et je pense que c'est ça qui est difficile en ce moment, c'est que la plupart des gens probablement n'ont pas forcément une opinion bien arrêtée, mais avec ce tsunami d'informations, en fait, ils vont devoir avoir tendance à aller d'un côté ou de l'autre en fonction de ce qu'ils reçoivent. Et nous, on a mis en place des outils déjà pour essayer, non pas de lutter contre ça, parce qu'on sait qu'on ne peut pas éliminer l'infodémie, on peut juste la gérer au mieux possible, de façon à ce que les gens puissent recevoir, avoir accès justement à l'information qui va leur être nécessaire pour prendre des bonnes décisions pour leur santé. Et donc, il y a des façons de gérer l'information en santé, en tous les cas, pour avoir une meilleure santé qui sont plus favorables que d'autres. Et on essaye de développer justement cette conception que les interventions pour gérer l'infodémie sont aussi utiles que le vaccin ou les traitements, parce qu'une mauvaise information peut entraîner une mauvaise santé.
Because disinformation can lead to a bad health situation. And once again, it's an issue of interface. We have to work together because journalists have a role to play, health professionals have a role to play, health authorities as well. Everybody has a role to play in managing this infodemic.
Pour nous, c'est très important parce que
for us, it's very important because we've seen that epidemics create fears.
Donc les deux vont ensemble, la peur et l'incertitude. Et quand on a un phénomène de peur, en fait, on a plusieurs réactions, mais une des réactions, c'est l'agressivité ou le repli sur soi. Or, ce dont on a plus besoin quand on est en face à une crise, c'est justement
sort of isolating yourself. But in a case like this, you need cooperation. If people become aggressive or they retire onto themselves, you get the reverse result. So it's important to fight this infodemic. 30 seconds, because we're reaching the end of the roundtable. Ivo Klaassen, same question.
Yeah, no, I think it's a very important question, and it's really interesting to listen to the discussion. I think with communication, and I'll do this in 20 seconds, what you do see is that a lot of the spectacular new facts and negative news gets amplified on Facebook, Twitter, etc. quite easily. And it plays on easily mobilized sentiments with people, like anti-authority, anti-government sentiments. I think that's an additional role to play. Our responsibility is to stick to the facts, but also to look at how can we communicate our messages and how can we communicate, for example, the message that the agency has given on pharmacovigilance, side effects of vaccines, etc., in a responsible way. Stay to the facts, but still try to reach out to those parts of the population that are very sensitive to also looking into other news sources. I think it also links very much to the topic that was discussed by Benoît on training. Training is also very much about communication, how you bring in the news, and indeed reporters could play an important role in that. Not exactly 30 seconds, but I tried.
Écoutez, c'était parfait. Je vous remercie tous.
It was perfect. Thank you very much. I would like to thank you all. If I can conclude, I will say everybody has to work together, and the silo strategy of France has to disappear because it led to some chaos at the beginning of the crisis. It was well corrected afterwards, but it led to some problems and to some lack of information for some populations that might have been better protected. Thank you once again.